Awesome. So we're going to pick up on our second part of notes here. If you've got page 3 of your notes, we ended with phalanges at the top of page 3 there. We're going to add on from there. So articulations. An articulation is a joint. It's where two bones meet. And so the definition of articulation is just that, a joint where two bones meet. Types of locations of joints. So there are 3 main types of joints, and it only has 2 listed, 1, 2, so write 3 off to the side. So number 1, freely movable joints. These would be your shoulder and your hip, your knees and your elbows and your fingers and your wrists. So just completely free movable joints, okay? Then we have semi-movable joints. An example of these would be between the os coxae and the sacrum, and then the vertebrae and the pubis symphysis where they meet. So it's like barely any give at all. And then there's the non-movable, which are the sutures. You've got in the skull. So once those bones kind of fuse together, there's no more, they won't move at all, okay? And so there's sutures there. And then the pelvis bone, that is the one that has the ilium, ischium, and pubis. And it's all one bone, but they've been fused together. So there's 3 different parts of that bone, okay? There we go. Next is ligaments. So ligaments attach bones to bones. They provide much of the support for our freely movable joints. And so how I remember this, a ligament attaches bone to bone. If you put 2 bones together, you can make an L, okay? So ligament, bone to bone. How I know this is different from the tendons, this is how I remember a tendon. A tendon connects muscle to bone. So when I think of that, I think of a T-bone steak, okay? I'm going to write something on the board here for you. So, I've got bone to bone, straight ligaments, okay? Ligament, bone to bone. I don't know if this works, writing on the board at the same time. Ligament, okay? And then I don't know if it's backwards for you or not. You'll have to tell me. Somebody tell me if that looks like an L to you. And then a T-bone steak. Okay, so we've got a yummy, there's the bone inside the T-bone steak, okay? And this is all muscle, right? So that's like the meat that we're eating off a T-bone steak is just muscle. So it's muscle to bone. So a T-bone steak, tendon, okay? Ligaments, bone to bone, tendons, muscle to bone. Next we get to talk about some fractures. So when you break a bone, there are different types of that we call them. Definition of a fracture is a broken bone, and we have a closed or a simple fracture. A closed fracture is broken bone that is inside, still inside the skin here. You can see this break here. A compound fracture or open or compound fracture is where it cuts through the skin. You might have seen there was a basketball player a couple years ago who broke his ankle, or just above the ankle there, and it broke through. It was a compound fracture. You could totally see the bone sticking out. Pretty gross. I actually witnessed a girl who was playing softball who broke her femur, and that is the largest bone in your body. That's a hard one to break. But she was going into third base and decided last minute not to slide, or she was going to dive, and then she decided she was going to try to slide in, and her femur just snapped. And you've got to be really careful, especially those that the large bone there right up next to an artery inside your body. So your femoral artery goes through there, and if your bone breaks and cuts your artery, then you could actually bleed to death inside, and just not even know what's happening. So yeah, both fractures. The good thing with bones is that they're living things and they heal themselves. You just have to get them back into the right position again, to be able to make those connections and line up. I had a daughter who fell off a bunk bed and she broke both her wrists, and they were totally just hanging. Her wrists were like, but when we took her in to get them set, I just couldn't believe the amount of force that the doctor had to use to pull her hand away from her elbow, and then to get those bones to match back up again. And he had to do it on both sides. Oh, so I mean, because you still got all the tendons and muscles all around it, right? And so when that bone breaks, those tendon and muscles are they don't really have anywhere to go, so it's going to come back like this. And so in order to get that bone back, you have to stretch everything, set them right perfectly, and then release it so they'll set back together again. And that's why too, some people, when the bones are so bad, they have to get plates put in or pins, right, to hold their bones in place while they heal. Okay, next we're going to talk about, let's see, some signs of a fracture. So painful upon palpations or touching, pain with movement, obvious deformity. Usually it is caused by a trauma, some sort of blunt force or change in that bone. Treatment for a bone break would be immobilization for 6 to 8 weeks, and compound fractures may require surgery. Okay, next we're talking about scoliosis. Scoliosis is an abnormal lateral curvature of the spine, okay? So a normal spine is pretty straight. Scoliosis would be where that spine curves, okay? Some signs and symptoms would be one hip or one shoulder is higher than the other. So if you've got that curve in the spine, you might be twisted just a little this way, right? Back pain, muscle spasms. The cause of this could be an imbalance of muscles, and so the muscles are actually pulling and pulling that spine out of place. You could have a leg length discrepancy. So if your legs are, one leg is shorter than the other, then it would pull, the pelvic girdles off center, which then pulls on the sacrum and the spine, and everything twists. Treatment would be bracing, physical therapy, shoe inserts, and in some cases surgery. And that is a very intensive surgery to try to fix. So there are two other types of scoliosis, or types of spine curvature problems. They're not listed on here. You could put them off to the side if you want, but kyphosis is when abnormally enlarged thoracic curve. So that's the curve of the back. Okay, so that would be an extra curvature up there, kind of giving you that humpback look, kyphosis. And then lordosis would be an abnormally enlarged lumbar curve. And that's the lumbar, if you remember, is the one further down. And so over here, your lumbar down here, and that would be the curvature coming in more into your abdominal area. Okay, so that is lordosis. Okay, you do need to know osteoarthritis, and this is arthritis that is caused by a breakdown and loss of cartilage in the joints. So you can see here we've got a healthy knee joint here, and then here is cartilage and some bone spurring happening and things, erosion of cartilage, and that can cause quite a bit of pain too. When you lose the cartilage and you start getting bone on bone, it rubs and hurts. So a cause of osteoarthritis would be just normal wear and tear on the joints. Maybe specifically caused by obesity, right? Because you have all that extra weight on those joints. Or an injury to a joint that is not cared for properly. That can also help add to osteoarthritis. Signs and symptoms would be joint soreness, aching, stiffness, and swelling. Some bone spurs may develop with increased pain and loss of motion. Some treatments would include pain relievers, steroids, surgical joint replacement. So I don't know if you've noticed, sometimes elderly people's hands will start looking like this, and they get some extra bone spurs around all their joints. And then, I mean, it can get so point too that the joint, the hands just kind of, what do you call it? Curl inward and stuff. Yeah. So that's osteoarthritis. Okay. Then this is not on your notes. You need to definitely add this in. So add this in under sprain. So add an E after. Osteoporosis. So this could include genetical factors, age, nutrient and hormone levels, a lack of activity, and even smoking can lead to osteoporosis. So signs and symptoms are loss of your bone mass leading to brittle bones that will break easily. The treatments can include therapy, drug therapy, weight-bearing exercises, and dietary supplements. So as you get older too, this definitely happens. And if you can see here, a younger male standing straight, right? And then as you get older, this osteoporosis sets in and the bones get brittle and weak and kind of compact down on each other. So you'll actually usually get shorter as you get older, and you're not really shrinking. It's just your bones and your body are moving differently, and compact, and so you get, shorter. And then the last is a sprain. So it is the stretching or tearing of a ligament. Okay, so the sprain is a ligament, and a strain with a T, that is a tendon. So again, how to differentiate? Tendon is another T, strain, sprain, ligament. And there are different degrees of a sprain. The first degree is the stretching of a ligament that causes micro tears. So you've just got a little bit of tearing in there. It still causes lots of pain, very hurtful. Second degree is a partial tear. So then you get some sort of, we're going to do this with a piece of paper. Are you ready? Okay. Let me pull a piece of paper out here. So say you've got a ligament. A first degree would just be like a teeny little tears, okay? So something like that. I don't know if you can see through it. Second degree would be something like this. The ligament is still intact, but it's got a decent sized tear in it. Third degree is where that ligament gets pulled altogether, okay? That's third degree. A complete rupture, they call it. So signs and symptoms would include pain, swelling, joint laxity, instability, bruising. You definitely would see some bruising. You treat with RICE. And so RICE, know this acronym, RICE is rest, ice, compression, and elevation. I don't know if you can see that down there, can you? Maybe it took. Rest, ice, compression, and elevation. So stay off of it, keep cold on it. Compression is putting a little pressure to it, and then elevation, keeping it up. So if you've got a sprain on your foot, your ankle, you'd want to keep it up on a pillow or something, lay on a bed and keep it up. Okay. Woo, that's it for the notes. Okay. If you haven't started yet, you need to do your skeletal poster, okay? We have a back view and a front view. You'll cut them out and then put them on a sheet of paper. If you put two white pieces of paper together, like this, glue them right there at the center, you'll have a long enough sheet to do your skeleton on, okay? And you're gonna put the skeleton on one side of the front view on one side. I'm going to grab a sample for you. So you're putting together your own poster for this one. So there's the front view. You will color code it. If you colored the femur on this one, the femur is blue, so cover this femur blue also. And then when you turn it over, make sure those femurs get colored blue also, okay? Once you have your different colored bones, if they're touching each other, I want you to use a different colored bone, okay? And then label them. So all the bones that we've discussed, you will label. You will also label the ilium, ischium, and pubis. You will label the pectoral or shoulder girdle and pelvic girdle. And then you'll also label, if you can see back here, we've got the cervical part of the vertebrae. This is best to do it on the backs because you can see it from the front. Other bones cover it. So you've got the cervical bones, the thoracic bones, the lumbar bones, sacrum and coccyx, and these are part of the vertebrae. Okay, the whole spine is the vertebrae, but I want you to split those up. For the hands and feet, color the wrist bones the same color, color the hand bones a different color, and then cover the fingers and thumb a different color, the phalanges. Same with the feet. The ankles bones a different color, the foot bones, metatarsals a different color, and then the phalanges of the toes a different color also. To differentiate the skull, so whatever ones you can label from the front, label on the skull and color those bones differently. Same thing on the back. The occipital you can only see from the back, so make sure that gets labeled. You can label the mandible also from the back. You'll probably want to label the scapulae on the back. You could do it on the front too. It sees through. So you only have to label one side of it. So like if you say this is the humerus, I'm going to know it's the humerus on the other side too, okay? Same thing, but on the front, if you label humerus, I do want you to at least label one humerus on the back too, okay, and have colored it the same color. So your poster is going to be worth 40 points, so make sure that gets done, and you can either send me a picture of it or you can show it to me on a Google Meet, okay? We're good here. Check back soon. We will, are we doing any more notes? We won't be doing any more notes. I do have a couple of things, worksheets though, on the skeleton for you to do. And so we'll get those in next week. We'll be doing a review. Also, you should go to ABC YA games, and you can find some great skeleton games, some tutorials and things of putting the skeleton together and filling in the blanks and stuff, so that you can figure out and get these memorized. All these bones that we've talked about here and that you're putting on your skeleton, you need to memorize. I will give you a blank skeleton for the test, and you fill in the blank, and you have to tell me where the patella is. You have to tell me where the sacrum is, okay? All the things on your poster you'll be responsible for, and it won't be from a word bank. Like, you have to come up with it, okay? I know you can do it. So, and we'll figure out a way to do it for you guys testing at home. We'll probably ask most of you to come in and do it after school sometime. If you can't, then we will schedule a time that I can watch you kind of over the computer, or we can just do a verbal one, like you can just name them as we go through. So somehow we can get it done. If we have to do it by a Google Meet, we will. Okay. As always, email me if you have any questions. If you are confused at all about any assignments that are given, email me. Okay. I am totally up on my emails. Okay. Love you guys. See you soon.